When you see a child come back that you've helped return to health, and they give you a big hug and they thank you, there is nothing more special on this earth. You can't buy that with money. You can't do anything. It's just a wonderful, wonderful thing to know that you're able to help kids every day, and just to see them playing and know that you had a little part of that. And I think that's probably the greatest thing anybody can do, is leave a legacy in which they create something that helps future generations achieve a better life.
Dr. Rieger started this practice 30 years ago, and he had a vision. His goal wasn't just to be a pediatric orthopedist. His goal was to make one of the best pediatric orthopedic groups in the state, if not further. He's built something special.
I got interested in pediatric orthopedics during training. I always enjoyed working with my hands and carpentry. And then during my training, I ran into Dr. John Hall, who is a world premier pediatric orthopedist, and he influenced me. And then seeing the joy of how you can change kids' lives, it was just, I fell in love with pediatric orthopedists and never looked back since.
It was such a fascinating field. It was totally different than any other medicine that we learned about in medical school. And coming from an engineering background, all the stuff we did in surgery kind of makes sense.
My very first patient that I saw was 2 days old when I saw her. I was treating her for hip dysplasia. I had the joy of not only getting to treat her and have a picture of her when I first started, but got to see her when she was 16 years old. When I saw her originally, I was bigger than her, and now she's got me by a couple inches.
So I have treated patients, their children, and actually now I'm on the third generation. And some of the interesting things are, like one patient recently where I treated mom for club feet, and that was surgical back in those days, and now we use the Ponseti technique, which is not operative. He says, "Why didn't you use the technique on me?" I said, "When you were a little girl, it wasn't around." So there's been many changes over the years, and you always have to be looking to do what's best for a child.
In the last couple of years, we've come across a couple companies that make what we call bioabsorbable implants. For example, one of the more common surgeries that we have to do in young people is to fix their broken ankles. We found 2 or 3 companies where they made screws and implants. They fix the bone, secure it, and over the course of 6 months to 2 years, they completely disappear. We've had a 100% satisfaction rate from our patients.
Scoliosis is true to my heart because my daughter had scoliosis. We now have adaptive Firefly. It allows you to have a very low dose CAT scan which reconstructs your spine, so we actually see the patient's spine. It has guides which are very precise, so when we drill we know the depth of the screw, the direction of the screw. We brought in the EOS X-ray. So EOS X-ray is an imaging machine that is anywhere from 10 to 20 times less radiation. So those are many, many innovations that we've brought to the area, and always trying to stay in the cutting edge.
In the newborns, it is very common that we end up using ultrasound in order to be able to evaluate the hips, which you very often won't be able to evaluate on x-rays or with other modalities when they're below the age of 6 months.
With the imaging, we can now do 3-dimensional reconstruction, and you can actually rotate it 3-dimensionally in space, and you can pre-plan or see how your surgery is actually going to impact the structure of the hip, so you can formulate the best possible plan to reconstruct that child's hip.
We've developed techniques to be able to avoid the growth plates, so that way we can get a proper ACL reconstruction without risk of causing damage to the growth plates. That's moved all the way on to the bare or the bridge enhancing ACL reconstruction, where we're using biologics to help repair the ACL rather than having to take tissue from the knee to reconstruct it.
With the advent of these new devices, we're trying to have as small a footprint in the human body as possible. In our case, less is more for us. One of the most memorable experiences I've had with a patient was a young lady. She was 9 years old, healthy, but her main problem was she was always a toe walker. So, we offered her what we call zero casting, where it's not surgery. We put casts on every other week, and as the casters start to set, we bring their ankles up and stretch them out. We took the cast off. She could not even stand on her toes after that. And we got her into a little therapy, got her ankles stronger, and for the first time ever, she made the cheerleading team. Her mother came in tears. She's like, she's never seen her so happy, and that was her only goal in life, was just to be a cheerleader.
When a child walks into this practice, they're going to get exceptional care, and I know that we have created something that will live way beyond me, that will continue to help children's lives.